What happened yesterday was really an awful situation with the NFL player who had a cardiac arrest on the field. And while we don't know exactly what the cause was of it, we know that there are a few possibilities of what it is. People have been speculating that it could be something called commotio cordis. And what that is when there's a sharp or a high force object that hits the center of the chest. And if there's a certain time window in the electrical signal of the heart when that sharp or that object hits the chest, it can cause a cardiac arrest and someone can have ventricular fibrillation. However, that's not the only possibility. And we know that there are other things that can cause cardiac arrest, and whether that's due to cardiomyopathies, which is problems with the heart muscle, things like hypertrophic cardiomyopathy or dilated cardiomyopathy, or due to other possibilities called channelopathies, which are electrical abnormalities of the heart. So it's really tough to speculate exactly what happened. So there is a difference between a heart attack and a cardiac arrest. So a heart attack is a plumbing problem. So that's an issue where one of the arteries of the heart gets blocked. That's very different than a cardiac arrest, which most commonly is due to an electrical issue where you have a life-threatening fast heart rhythm, something called ventricular fibrillation or ventricular tachycardia. So that is presumably what happened yesterday, is that something caused his heart rhythm to go super fast and it needed to be shocked to get out of it.
If an athlete has a sudden collapse, they're standing up and then they fall down, it should really be a sudden cardiac arrest until proven otherwise. You get out there and you've got your differential diagnosis about what may be the cause. And so you think about the three things, ABCs, airway, breathing, and circulation first, and you sort of tick through that and then try to sort of hone in on the cause and then treat specifically that. One of the things that's really important with sudden cardiac arrest is to recognize it. Oftentimes it goes unrecognized so that it can be treated, and then to have an emergency action plan in place so that it can be treated properly. So those were some really key things that were important. And you could see that he had immediate attention on the field and got to a level 1 trauma center like Harborview very quickly. The sooner you get CPR, and actually more specifically, the sooner that you can get a shock to the heart to restart it, the better the outcomes are statistically. And so the rapid response is just really critical, recognizing that it's a cardiac cause, because when a football player goes down, that's not the first thing that you think about, and you're always worried about the spine and other causes. And so a rapid response is really critical, and it was terrific that there was a rapid response there.
Everyone should learn CPR. Everyone has the ability at some point that they might be called upon to give CPR. So I recommend everybody be trained and learned in how to do CPR.
I think that there are easy ways to screen for things that cause sudden cardiac arrest. So an ECG can pick up about 2/3 to 3/4 of the things that cause sudden cardiac arrest, the underlying things, people that have an electrical or a structural difference in their heart that may predispose them. About 1 in 300 kids will have that difference. Now, obviously not 1 in 300 kids has a sudden cardiac arrest, but if we pick up these things, we can offer them advice on how to best treat this. And I think the thing to take home is that sudden cardiac arrest is rare and that it's unlikely to happen. But and there's a lot of benefits to sports and exercise. In terms of all the things that we have to worry about, that's not a high one. I think as parents, it makes sense to get your kids checked to make sure they don't have any underlying structural disease. But in commotio cordis in particular, people don't have any underlying structural disease. So that's a normal heart. And it's sort of like getting struck by lightning. It's an unlucky thing that can happen, and you shouldn't probably spend most of your days worrying about getting struck by lightning.